Yes, good evening. And how are you? So I'm 1 minute before the time. So I have to come online and say hello to you. So let's prepare and wait for some other people to join us. If you can hear me, tell me, where are you joining me from? Where are you joining me from? How are you? I see someone here. Good evening. Who do we have online? Welcome, welcome, welcome. Good evening and welcome to Ask the Doctors. So who do we have online? Can you hear me? I'm expecting my guest. Let's see how we go tonight. Yeah. Okay. Let's see. Okay. Yes, we are live. The time is 8 p.m. on the dot. Good evening, everyone. Yes, I see you. So where are you joining me from? Good evening, everybody. Welcome. Welcome. Tell me, where are you joining me from? It's 8 p.m. on the dot, and we're talking about menstrual problems, the way forward. Oh, yeah, let's go. Let me give you a shout out. Good evening. Good evening. Favor, I see you from Dubai. Okay. Share this live stream, please. Everybody, share this video. I'm expecting my guest to join me very soon. Yeah, let's go. Let's go. Let's go. Tell me, where are you joining me from? Oh, yeah, let's go. Let's go. Where are you joining me from? Okay, 15 people. Hi, good evening from Anambra State. Favor, I see you. Esther, I see you. Good evening. Please share this video. Yes. From Anambra, from Delta. Okay, let's go. I'm expecting my guest to come in very soon. You're welcome, everybody. Welcome, welcome. I see you all. Good evening. Joining you from Abuja. Lekwot Dorothy from Abuja. Yes. Okay, share this video. I hope we are all set for tonight. So we're talking about menstrual problems today. So if this is your first time on the program, you're welcome. My name is Dr. Frederick Unuigbokhai. I'm a medical doctor here in Nigeria. And I'm very passionate about health education. And this is what we do. This is Ask the Doctors. We've been having this program for the past 2 years, every Sunday by 8 p.m. I'm usually not alone. I have my colleagues, now brothers, as co-hosts. We usually have this program together. So I'm expecting them to join me. Okay, yeah, I have my co-host with me tonight, Dr. Israel. How you day?
I'm fine. Good evening.
Yes, good evening. Welcome. Happy Sunday to you. How family?
Family is fine. Happy Sunday.
Yeah, happy Sunday. Okay, so we are waiting for our guest to join us tonight. She's prepared. I think she's sharing the link. So everybody, please share this link to your friends, your friends, your family members, your village people, your WhatsApp group. Share it with them from Ireland. Okay. So today's topic is very interesting, and I hope we have a very interesting time, engaging time tonight. So Israel, so what's up? How are you? How was your day?
Are you
Hello,
talking to
Dr.
me?
Israel. Yes, I'm talking to you. I'm talking to you, Dr. Israel. Can you hear
My
me?
day went well.
Okay.
Yeah, I can hear you. My day went well.
Okay, very good, very good. As we start the program, please, guys, it's important you take note of your questions. So please have a pen and paper and jot down your questions. And then later on, we'll open the floor. You drop your questions. We do our best to take all your questions. I don't know what's happening. why she's not here. This is the topic tonight. So we're talking about menstrual problems tonight. Talking about what is menstruation and the problems. For those that have been asking me, I see my period 2 times in a month. Okay, our guest is here. Uh, Good evening, Ma. What happened? Uh-uh. What happened? She went off. Chief, please send your request
Yeah, I was
again.
surprised that.
Ofuri, how are you? Good evening. Happy Sunday to you. I don't know what happened. She was here just now. I guess the network. Okay. Let's see. I'm trying to bring her up. Good evening. Jack, how are you? Grace, I see you. Sonny from Port Harcourt, I see you. Okay. Okay. I guess she's back.
Can you
Yes.
hear me?
Yes, I can hear you. Good evening, Ma.
Okay. Good evening. Good evening. Good to see you
Good
guys.
evening, ma.
Hi. It's good to see your face. So you be like say that they chop well.
No. It's good to have you back join us tonight, Ma. It's
Thank you.
it's a great privilege to always have you in our midst. So, ladies and gentlemen, if you are just coming, you're welcome. We have with us tonight Dr. Esele Ekuaze. She's a very, 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 very our Oga. So yes. And we're talking about menstrual problems. She was one time the president of the Association of Resident Doctors and the Irrua Specialist Teaching Hospital. She's a senior registrar from the Department of Obstetrics and Gynaecology at the Irrua Specialist Teaching Hospital. And she won one award. Chief, what was the award? The award,
it was
please.
it was you like to I don't like blowing my trumpet.
Please, ma. What was the award?
I'm not hearing you guys
It's one
clearly.
award like that.
Okay. Dr. Israel, is your network. Okay. Welcome, ma. Thank you so much for joining us today.
Thank you.
So we want to go straight to the point. Before we start talking about the problems of menstrual problems, I think it would be nice that we talk about what menses is, the normal menstruation. What should a normal woman, a physiological woman, expect when she's seeing her period?
Yeah. Yes, very true. So menstruation, or what we usually say menses, is something that occurs when someone has attained puberty. You know, a child transits from childhood to adulthood. In between that transition, you have what we call puberty. And one of the features of puberty is menstruation for a woman. So when you move from being a child, 10 years, 11, 8 years, 9 years, you start developing breast. And then later on, you start seeing axilla hair in your axilla armpits, and then hair in your pubic region, where we call private parts. So before you know, when you get to 14 years, people start menstruating. People can menstruate 8 years, 9 years, 10 years, 11 years, 12 years. But what definition for menstruation in a layman term, because I know a lot of people that are not medical part of this program, it means in a simple way, monthly shedding of your womb. Every month your womb breaks down. Some people will say weeping of a disappointed womb. A womb that was expecting to take in, realize that there is no baby, and then starts crying. So monthly shedding, monthly weeping of your womb is what we call menstruation, and is a sign that a woman is a woman, and that the woman has a womb, and that the womb is functional, and that the woman has the propensity or the potential to get pregnant. So that's what menstruation is.
Okay, thank you very much, Mark. If I may go further, At what age should we expect a young, let's say, young girl now to start seeing her period? We know there's an age of puberty. What is the current age with regards to our environment, and at what age should a woman stop seeing her period, so that we have this foundation as we proceed, ma?
Yeah, that's very key in today's topic. Usually, when a woman, some girls at 8 years, 9, 10, 11, 12, 13, 14, but the average age in our environment is actually 13.5 years. That's the average age. But people can see it 8 years, 9, 10, 11, 12 years, 13 years, 14 years, 15 years. If a young girl, start menstruating earlier than 8 years, we call that precautious, like it came quite early. Such person should need to be checked. Such child should be checked. Then if a girl child gets to 16 years and had never menstruated, he's 16 years, there's a problem, called that delayed. So there is a problem there. Or he start noticing that she has developed breast when she was 8. She had hair in her armpit by the time she was 11. She even had hair in her pubic region. Now she's 14 years, yet she's not menstruating. Such a child, such a girl, if you are such a girl child, you have such a girl, a friend, a relative, a sister, or you are the parent of such, you should visit the hospital so that they can quickly check what might be wrong. Then a woman, by the time the woman is getting to 45, 50 years to 55 years, women usually stop menstruation. We call that menopause. Now, in our Nigerian environment, study that we don't say that average person, woman in Nigeria, when she stops is 49 years. But we usually give it a range, 45 to 55. In abroad, average year is 51 years. But in Nigeria, we tend to stop menstruating earlier than those people abroad. So there's a range between 45 years and 55 years. If you are less than 45 and you stop menstruating, it's good that we call that premature menopause. So there is also a problem there. Then if you are above 55 and you are still menstruating, there is likely a problem there. So that's a delayed menopause. There is also a problem there.
There's also a problem. So when the menopause comes before the time, premature, and when it comes after the time, is delayed. Delayed menopause. Okay. As we continue, Ma, what is the normal duration for menses in a woman? We know that certain women will tell you that they have their menses, they see their menses, their period. Some would say 4 days, 5 days. Do we have a standard duration that a woman should see her period?
Okay, the range usually is 2 days to 7 days. So a woman can see her period for just 2 days. Like you come to see some young girls, they'll say, my period is 2 days, or they feel there is a problem. If your period has always been 2 days, there is no problem. Then some people see it for 7 days. If your period has always been for 7 days, there is no problem too. So it's between 2 days to 7 days. But most women we see between 4 days and 5 days. So that's the range. Before I even conclude on that range, now when a child starts menstruating, the menstruation is usually erratic. Like it's not straightforward, like you are seeing it every month, because of the fact that the brain of the child is still developing. So it's not yet regulating the body of the child very well. So you see that the menses is up and down. She will even see it in that first period. She will even see it for 10 days. She will see it for 10 days. Then for 2 months time, she will even see it again. Then like that. After 8 months, you will see that the menses now, the brain now gets matured, is now releasing what it needs to bring out every month as at when due. Then the person starts seeing the menses regularly. So in that, if you were a young child, let's say by 10 years, you started seeing that menstruation. You saw that you were menstruating for 8 days. There's no problem with that. Then after 6 months, you now realize that your menses has now come down, so you are now menstruating for 4 days, 5 days. is very okay. So you now realize that 4 days, 5 days is now your normal menstrual cycle. So that's very fine. It happens in almost all women during their pubertal years. So, but if you are someone that when your menses is now 4 days, 5 days regularly, then something now drops or it gets higher, then there is a problem there.
Then there's a problem. Okay.
Yeah.
What you said right now, Ma, if we understand clearly, is that for most women, their period will be 4 to 5 days. But we know that some women could see their period for 2 days and even up to 7
Yes.
days. Okay.
Yes. And it's still normal. They should not be
And
scared that, oh, their period is 2 days. It's still okay.
it's still
Their period
okay.
can be 3 days. It's still okay. As far as it's every 3 days, like he's seeing the period 3 days in a month. The next month, he sees it 3 days in a month. The other month, he sees it 3 days in a month. That's very fine. You should not say, oh, my friend period is 5 days. Why is my own 3 days? Your body is working very well. So also the person that is seeing it every 7 days, like 7 days in a month, he sees his period, has period 7 days in a month. That is still also very fine. She shouldn't be worried as far as she's seeing it that 7 days every month.
Thank you very much. Dr. Israel, I think you have something to say.
Okay. What I want to ask is, okay, what it means is that we can actually say in the average of 3 to 7 days is the normal measures, or are we not going to say from 2 to 7 days? And also,
2
please,
to
our
7
viewers want to
days.
say, please, you wait with your question. After our discussion, you'll be able to ask.
2 to 7 days. That's the normal range. 2 to 7 days. Yes, if you are a woman, you are just seeing your menstruation 1 day or 1.5 days. It's not a normal thing. Or you are seeing it more than, yes, you are seeing it more than 7 days in a month. Is not a normal thing too.
It's not a normal thing. Okay. I think what Dr. Israel was saying is that please, if you have any questions, please wait after the discussion with Dr. Esele. You can drop your questions. We'll take it. And please share this live stream. Now, Ma, I want to ask these questions. Are there normal things that can affect a woman's period? Are there normal occurrences that when these things do happen, it will surely alter a woman's period? And if they are, what are they?
Yes, there are some things, physiological things that can affect a woman's normal period. Like you are someone that sees your menstruation every month, 4 days or 3 days or 5 days, but it's regular, you are seeing it. But suddenly you notice that there is a change. Some things can affect it, like stress. For instance, when people move from one environment to another, they change environment, they will notice that their menstrual pattern has also changed, because the body, well, maybe we would have also talked a little of why do a woman menstruate. A woman menstruates because of certain hormones in the body. The hormones in the brain, we call them follicular stimulating hormone and luteinizing hormone. They come from the brain. They talk with the eggs of the woman, we call the ovary. So the hormones in the brain talk with the ones in the ovary. Then the ones in the ovary, which we call them ovary, but you guys call them eggs. So those eggs talk to your womb every month. So that is the pattern. So the eggs now release the hormone that now speak to the ones in the womb before you menstruate. Now, if there is a change in environment, stress affects the brain. It affects how the brain releases those hormones. So the brain cannot release the hormone as it's supposed to release those hormones, and that can affect how your eggs also respond. So you see that the menses that month may not be as it used to be. You realize that the menses become short, or it become prolonged, or you start bleeding. Then apart from that, excessive exercise. Excessive exercise also does the same thing to the hormones from the brain. So you see that it's the brain that is actually in charge here. So excessive exercise also does that to the brain. Then that's why if a woman notices that, oh, she's not, there's nothing really wrong with her, but she has noticed that her menses has stopped, and we realize that she's a very high-tech athlete, like runs or plays football and all that, you just tell them that, oh, try and adjust. Sometimes when they just do that adjustment without any drug or anything, their menses picks back and become fine. Then apart from exercises and this, if you, I'm just talking first physiological things, so things that happen to us normally in life that can change the pattern of our menses. So it's not the problems like the disease. Now we are just talking normal thing. Then weight loss, you know, some people will tell you that they want to mix some tea, mix or to lose weight. Now in the process of that weight loss, they also affect the way the hormone also work in their body. So those hormones can change their menstrual pattern. So if some people who have experienced this, they were able to share their own testimony that when they try to lose weight, they notice that their menstrual pattern change. Because gaining weight, it has to do with hormones. Losing weight has to do with hormones. So those hormones are in charge of how you menstruate, how you even achieve fertility, and that can change. Those are the normal things that are around there. So people have talked about food, and the food, it has to do with also the weight loss things. So if you start eating food that contains a lot of fat, it also increases these hormones in your body. So you can see that sometimes when you are gaining weight and eating a lot of fatty meals, your menses begin to go very longer than normal, than even shorter as it usually do, that are not necessarily a problem in our system, like a disease that can affect our menstrual pattern.
Thank you very much. You've listed the normal things that can affect a woman's period: stress, exercise, weight loss, even weight gain, and certain food that the woman take. Okay, if we've said this right now, I mean, let's go to the main part of today's discussion. What are those abnormal menses? We know a woman can have very short menses, a woman can have very long menses. What are those things that can cause them? And what should these women look out for?
Okay, so short menses. So short menses. So a woman can actually have a short menses or a prolonged menses. There are names for it in medicine. So and we call some oligomenorrhea, like your menses has reduced. Now before we enter into that short menses, what is it? This person must have been having a normal menstrual cycle before you say my menses is now short. That means it has reduced from, if you were having normal menstrual cycle of 6 days, every 6 days you are seeing blood every month. And then suddenly you realize that it's now turned to 3 days or 2 days. That's, we call it oligomenorrhea. That means your menses has become is now shorter than normal. It's still, if you notice, it still falls within normal range. Oh. Remember that we said the normal range is 2 to 7 days, but yes, it has become abnormal for you that because woman, your norm, yes, for that particular woman, it is not abnormal for that particular woman because her menses was before. She was seeing the menses every 6 days, every 6 days in a month. Now she's not seeing it every 3 days in a month. That, for that woman, she has short menses and there's a problem. Now that's one, we call that oligomenorrhea. There's another one, because I will talk about each of them. There's another one that you were initially seeing it every 4 days or every 5 days in a month, but now you now see it 8 days, 7 days in a month. That is also there's also a problem there. If you notice, you are not seeing it, you were seeing it 4 days, you are seeing it 7 days. It still falls within the same normal range. Don't forget. So don't just say it still falls within it. No, for you, it was 4 days, but now it has become 7 days. So there's a problem there. So we call it that you are having menorrhagia, you are bleeding excessively. So that's 2. Another 3 that I would like us to discuss. Now, we didn't talk about the duration, what we call the cycle. You know, every woman has a cycle. There is some people have this cycle every 21 days. They are seeing their menses. Those are the ones that will tell you that they see menses twice in a month.
In a month, yes.
Yes. So there is normal cycle for every woman is 21 days to 35 days. That's the normal cycle. That means I can be seeing my menses every 21 days. I am normal. I can be seeing my menses every 25 days. I am normal. I can be seeing my menses even every 35 days. I am normal. It's a normal range. Now, if you now notice that you are not seeing it every 14 days, you are still seeing it twice in a month, but it's not every 14 days. That's also a problem. Or you notice that your menses is now, your menstrual cycle, the cycle that we talk about, 21 to 35 days, is now very long, longer than 35 days. That means you are seeing it once in 2 months. Like it gets to 40, 37, 40. Some people will see it even in 3 months, once in 3 months. That one too. That's a problem on it. So 4 key problems that we will look at today. No, let me say I actually wrote 5. The 5th one is pain during menstruation. That's the 5th one I noted down. So the first one is that the menses itself is short, or the menses itself is long. That's number 2. The menses itself is, the number 3 is that the cycle is short, or the cycle is long. Then the last one is that you're having pain during menses, which we call dysmenorrhea, So those are the 5 I think that we will look at today. So my menses is short. I was menstruating for 7 days. Now I'm not seeing it for 4 days. What might be the cause? One, apart from those physiological things which we talk about, exercises, excessive exercise, not just exercise, excessive exercise, stress, food, which we talk about, losing weight, which can cause that. Other things that can cause that, if you are on certain drugs, there are drugs that you can take that will depress or reduces your menstruation. For instance, people on contraceptive pills, it can shorten their menstruation, or some of the contraceptives can shorten their menstruation or prolong their menstruation. Then a very important one is, when people do abortion, especially abortion that they scraped inside, they will say they did washout. Then after washing out, they now notice that their menses has become shorter than normal, or is even not coming, or that is a big problem. That is one of the reasons that people who were having a normal menses before, that was 7 days, suddenly is now dropping to 2 days, 1 day, and sometimes it doesn't see it. A main cause which we have seen is a after abortion problems, in which they had an abortion, they did a washout, and the way it was washed out was, we call it vigorous. So when your womb started healing, it starts forming scars inside. So where the womb is supposed to shed, there is nothing to shed. So it's just the down part. So it just delete you. So 1 or 2 days, this is done, or there is no menses at all. So that one is a big, big problem in our society that can cause short menses. Another one is a disease condition, which we call polycystic ovary, but that one mainly will cause this one, you seeing it once in 3 months, once in 4 months, or seeing it just one day out of 7 days that you were seeing it before. But it's more people who experience that are seeing it more like once every 3 months, once every 4 months. That's in the cycle. That's where that problem leads to. Then infection, pelvic, what we call PID or pelvic inflammatory disease, is another core reason why girls, ladies who have their menses shortened, because when they have that infection and is not properly treated, the same thing happens inside the womb, in which you see that the scars, what we call adhesions, they actually scars, they form inside the womb because infection causes injury inside your womb. So when you is not healing, like somebody cuts your hand, when it's not healing, heals with scars. So by the time you are now menstruating, the menstruation starts just scantily. So that's what causes that one. Then for the ones that are prolonged, like you are initially seeing your menses every 2 days, but you now discover that you are seeing it 7 days, you are even using more pads, which we call menorrhagia. That one, many things can cause it. First is it may even be your system is changing from, especially for people who are gaining weight. So the system is trying to adjust to the new weight, to the new hormones that those fats are releasing. So the person starts bleeding anyhow. Another thing is uterine fibroid. I remember that we talked about uterine fibroid in this place one time together. We discussed it one time together. So fibroid is also a reason why people will start bleeding excessively during, and their menses will get very long, and then they say sometimes they may not even get very long. It may still be the same 4 days, the same 5 days, but the woman start using more pads. Yeah, instead of using 3 pads, you start using 5 pads in a day because of that excessive bleeding. We've even seen that some women may even prefer to use cloths because just now the pad don't full. Just now, let me just carry a baby napkin and put there so that I can absorb a lot of the blood that is coming out. So fibroid is a big cause of that. Then also, although this is a little high, people may be scared of this, but it's the truth. Cancer and also cause that for women. Like women that has cancer inside the womb can make them bleed, and their bleed can get so long. Then if there are growths, we call polyps, those we call them polyp. They are small growths inside the womb. Those growths can also make a woman menses, because as the womb is also shedding, the growth is also doing or bleeding its own. That can increase the woman's bleed. Then some women can be on some drugs that they don't. Actually, I noticed that from my small experience here is herbal medications. You know, a lot of herbal medication, we mix it with our own fertility drugs. Like a woman that wants baby, you will be taking a doctor, you still go traditional own, then we mix it, then we add our I've seen one analysis of a herbal drug that even have a lot of clomiphene inside, you know. So they, all those ones, they don't have dosage really, they don't. So when you take that and you didn't get pregnant in that much, you see that you bleed more during, you sometimes they may be thinking that, oh, he just had a miscarriage. No, the load of drugs that was in the system, that was why menses got prolonged at that period. So the which one, then the third one where the cycle is short, like you are bleeding every 14 days. Let's say your menses was 21 days, 22 days. You now notice that you are bleeding every 14 days, every 15 days. Most often than not, those women that are bleed like that, we notice that is usually uh, is that had not yet been cancer. We call it hyperplasia, that are mainly the cause of, we that kind of bleeding. We call it intermenstrual bleeding because you are bleeding 14 days. So those women, when they check them, they will realize that is a small cancer that are not yet formed, that is going to be cancer in future in like 14, 15 years time, or even 5 years, that may be that. Then also polyp can also give us that it growth inside the womb can also. Then sometimes we also realize that nothing causes it. It's just iatrogenic, like it occurred. You check everything, nothing. It just happened. So those are that. Then the last one is that prolonged or delayed. Is it prolonged? I'll call it now menses. The cycle is very long. Critical one we have many ladies have about it is that polycystic ovarian syndrome. Polycystic ovaries means that the ovaries have some cysts. As we said, that the brain talks with the ovary talks with the womb. I mean, the brain talks with your eggs talks with the womb. Yeah. So now there are small bag of water inside the eggs. So those small bags of water, they don't have the ability to bring out the hormone as at when due. So you can't your menses every month. You start seeing it every three months. And sometimes you now notice that you start having hair in your chin, in your chest, in the back. You are gaining weight. Your voice starts changing, gets deep, like that of a man. And then by do a scan, they will these the bags of small bags of water we call cysts are in the ovary, around the ovary and lined up there. So, and the good that one is we see it, we are very happy because it has solution. It's very when any gynecology see polycystic ovary is happy because it can treat it. It's easily treatable. Unlike if you see addition inside the woman's womb. So after that, the last one is this dysmenorrhea. You know, pain during menses is a big issue because this pain during menses can be primary, like it occurs right from when you were menstruating. You notice that you are having pain during your menses, or it can what we call secondary when it wearing like that before. You don't used to have pain during menstruation, but suddenly you notice that whenever you are menstruating, you now have pain. So the primary that you have pain during menstruation is common. Is something that happens because of um as the womb, the egg burst open, it release some chemicals. So those chemicals they tend to touch the body of the womb and start contracting them. So and start making them painful, like pressing on them. That gives you pain. Over time, women outgrown it. Like as they are growing, they realize that, oh, this pain, I no longer have pain while I am menstruating. Why some they say that when they give birth, they no longer feel such pain during menses. And a simple reason is that your womb has experienced the childbirth pain. Is it the dysmenorrhea that is small that the womb suddenly just realized, this is not so serious. If I can pass through this process, that means that one that I was feeling before is not really a big issue. And also those
Please, can I add something to that? Because I've heard some ladies say that after giving birth, the pains will go down. Why for some, after giving birth, the pain does not change. It remains the same.
yeah, psychology also works with pain. The psychology of the woman also works with pain. Like those people that their pain goes down, really, one factor is that when they experience childbirth, like even when they feel the pain, they no longer realize that it's actually pain. Dysmenorrhea they are feeling. Then the muscle of the muscle of the uterus also have experienced. It has changed compared to when it has not experienced a pregnancy before. So a little painkiller is what we usually give for any lady that experience primary dysmenorrhea, like is occurring with every pregnancy. So when it takes painkillers, takes a lot of water. Sometimes we say use hot water bottle to massage the tummy. That relaxes the tummy and relaxes the muscles there. So the muscles don't start contracting. Why the ones that you weren't having pain you weren't having pain before during menstruation, then suddenly you now notice that you are having during menstruation. That one is a big issue because in majority of the case is that if the lady is sexually active, majority of the case is due to infection, a sexually transmitted infection. That is like a sign that you are having a pelvic inflammatory disease or a sexually transmitted infection, because infection is what causes that pain during menstruation. A classical way to know that this is primary, like there is no problem when you have pain. Why I'm saying this is to cause maybe someone to relax the mind. A primary way to know that this pain that I'm having during menses is not a big issue is that the pain usually starts before your menses starts. And as your menses starts, after that first day, the second day, you are now okay. You can go about your normal activity. Why the one that needs to be addressed is that the pain starts before the menses start and continues until the menses stop. And sometimes after the menses stop, it takes a while before you get back yourself. So that particular one needs attention. So is there anyone I have not talked about?
I think you touched almost all of them right now. You did, ma. You spoke about you spoke in the short period, you spoke about the long one, and then you spoke about pain, and spoke about I think heavy prolonged bleeding too. Which other one again?
Yeah.
Yes.
Yeah. We spoke about.
Okay. If you are just coming, you are welcome. We're talking about the menstrual problems, the way forward with our guest, Dr. Esele Ekuaze. So if you have questions, please, you can drop your questions in the comment box and we'll do our best to take your questions. I have some of them, and I think Dr. Israel would read some of these questions. Dr. Israel. Okay.
Yeah, I'm with you.
Okay. Please, let's
I should read the question.
Yes, please.
Okay, what if there is irregular period cycle, like sometimes it might be 27, 26, 28, and there is no stress and not taking any pills? Is it normal?
Okay,
someone that is having a cycle is not, yeah.
Yes, I was really hoping that somebody asked this question. That means the person was really very listening, because I purposely skip it and look forward to someone ask such a question. So only 4% of women we have their menses on every 28 days. Like my menses comes every 28 days. I must only that's 4 out of 100 women we have their menses it will just say my menses every 27 days, my menses every 26. That means in a year, every 26 days her menses starts. Majority of women, we have it as a range. That means this month it comes every 26 days. The next month it can come 28 days. The next month it comes 29 days. The next month it falls back to 27 days. But the range between when you are seeing your menses this month, next month, is not more than 5 days, 5 to 7 days. Like for instance, now my menstrual cycle, if somebody asks me, I'll say, oh, my menstrual cycle is usually 26 to 29 days. That's what I usually say. People, so I see my menses every 28 days. But if you take time to put a record, you will notice that this month you see it every 27 days. You counted it on the 27th day, the menses start again. But the next one, when you are counting, you saw that now 29 day follow. Oh, you count again. Oh, now 30 day follow. But the range, like if you can't tell if you have a range of more than 5 to 7 days. Like I see my menses 21st of October, and then I'm expecting that by 28, by 27, 28, 29, I can have my menses. I can still have it at 30 days, there's no problem. I can have it at 31st day, there's no problem, because it still falls within, because I've calculated that my regular period falls between 27 and 29 days. By the time I'm not seeing the menses at 35 days after, because it has passed 5 days range, then there's no problem. So your 27, 26, 28 is very perfect. There is no problem. There is no issue at all.
Okay. I think we have another one. What about period coming out for 2 days only?
Okay.
This person joined
Another
us.
question.
Yes.
What about period coming out for 2 days only? This person just joined recently, not too long.
Okay, so we said the normal range of period is 2 to 7 days in a month. In a month, a woman can have his period 2 days, is fine. Some women can have it 7 days, is fine. So there's no problem. But however, the clause we put on that is that if my menses is 5 days and suddenly, like I have been seeing my menses every 5 days, and suddenly I'm not seeing it 2 days. That one is a problem. That's a short menses that you need to report to the hospital. So, but if it's a normal thing that you are be having your menses every 2 days, it's fine. That's not a problem.
Okay. I think there's another one.
What?
Dr. Israel.
Yeah, there's a question. What of a nursing mother of 11 months baby who stopped seeing menses since April? Note, not pregnant. The menses came bit by bit and later stopped for almost 6 months now.
Okay. I sort of understand the question, but let me start with, when you are a nursing mother, you give birth, there's what we call lactational immuno, like because you are breastfeeding, you are bringing out breast milk, you might not be menstruating. Most time when you're actually actively breastfeeding, for good 6 months, you will not be menstruating. It's like a natural way God used to help us space our children properly. So in some women, this absent menstruation can last even till 11 months, 12 months, until they stop their baby from breastfeeding before their menses comes back. Especially those that really did that exclusive breastfeeding. So when they do that exclusive breastfeeding, some of them, by the time they continue, they not even introduce food, because the baby is so attached to the breast, their hormones are still at a low level, a level not to cause you to start ovulating and then start menstruating. So you will the person remains at that level until he stops breastfeeding. When he stops breastfeeding, the menses sort of return. Now, if the woman did not see menses after then, the first thing you should do is that you should go and do a pregnancy test. That's the first thing. When he does pregnancy test and the pregnancy test is negative, first he should give himself a few more months, and then like he starts breastfeeding, and gives himself a few more months, and the menses did not still come. He should come for a proper checkup. One of the factors is that, how did she deliver? Did she deliver? When she delivered, what happened in the process of delivery? A little story I will share is that there was this lady that delivered. After delivering, he had the bleeding. So after the whole process, they forgot to give her antibiotics. So when she got home, she had this foul smelling discharge that now later stopped. But after she went to chemist and they actually gave her antibiotics. The thing actually stopped. So she's breastfeeding. She's not menstruating. She didn't in her mind know that there is a problem, because she's breastfeeding, so she's not menstruating. So when she was done with breastfeeding 6 months, noticed that in her first baby, 6 months after, she was started menstruating 7 months, 8 months, 9 months. She thought that, okay, now because of breastfeeding of the baby, so she stopped the breastfeeding of the baby, hoping that she'll start because she actually wanted to give birth to her children fast. The menses wasn't forthcoming. So before she said, let me go and check. When we were trying to check her, we realized that, oh, her hormones were fine, but her womb, during that infection, the womb has healed and formed those scars that we talked about. So the menses didn't come because there was scars inside her womb. Then, so that might just be a cause of why the menses is not forthcoming, why she's not pregnant. Another thing is that it may be that your hormone mainly has not come back in full force. Actually, that I think I heard you say she was spotting small, something like that. I can't remember the question.
Yes.
I hold a part that she spotted 1 or 2 months. So it's very possible, okay, came bit by bit and later stopped for almost 6 months now. So it's very possible that is a hormone problem. So if we check your hormone, they'll look at the level and know what's the level. Is the level enough for you to be having menses or not? So it's good that this person should not just keep quiet. She should check herself up.
Okay. This other question says, what if you have menstrual pain when you started menstruation, but later the pain stopped? Hope there is no issue.
Okay, I think I mentioned this during my discussion. I think so. But what I said, if I reiterate, is that this dysmenorrhea we are talking about, a way to know whether you should seek for help or not seek for help is that if your menses starts and you start having pain, let's say it started a day before or a few hours before, or that very day, then after the menses starts, the menses starts for, the first day is just coming, then before it now starts full force, and you notice that the pain has vanished, that pain is not an issue at all. Those are primary dysmenorrhea. They are not dysmenorrhea. You should worry yourself. You should just, if that first day, you can just take pain relievers, take a lot of water, and we use warm water to massage your tummy. So that's this one that you said there's no issues. When you have it, the pain comes a day before or the day of the menses and continues throughout the menses, needs to be attended to, and most time is due to an infection.
Okay. I think we have another question here.
Is it normal for periods to smell?
No, it's not normal for period to smell. It's not normal for. I think the period should be clean. When I mean clean, is blood. It's like blood coming out for your body. So your blood is clean. Your period should not smell. Yes, there is a normal smell of blood, though. Don't forget. For those of us that are medical people, we know that blood has, even you that are not medical, you have seen blood of your child, a neighbor, whatever, even of yourself. There's a way blood feels. That's how a menses should feel, apart from the fact. But if you start smelling, and so people will say their menses gets darker, it smells, that should signal to you that it's not a normal thing for menses to smell. And if you watch it, you realize that when you started the menses, it wasn't like that. When you were menses, all of a sudden you start noticing your menses is smelling, is dark. So that is definitely not normal. So, and nobody would deny it's still infection. It's just that the thing is that the infections in the woman body is a big topic of its own. And people will say, I have infection, my menses is dark, is thick, is smelly, and they will just go and take medicine, miss antibiotics. No, now those things, we need to find out what particular infection is causing this kind of thing. By some questions we'll ask you, some check we will do for you, and then tests that we do to know the organism, what is making That's the thing. Then there are people that their psychology also tells them their menses is smelly, but meanwhile it is not. Uh, Sometimes maybe it's difficult. Maybe may ask somebody, oh, do you, especially if you have a partner, do you think that this thing is abnormal? Because sometimes some people's psychology can also make them think that their menses is. Somebody came and told me her menses is very dark. I said, okay, when you are menstruating, you come, let me see it. By the time I see it, it was a normal. She was like, but it looks dark. I said, no, when it's coming out, it's not dark. But by the time you leave the pad for longer than longer, because we're just talking of menstrual problem, we would have talked about menstrual hygiene. eh? If you leave the pad for longer than normal, it becomes dark because it's blood. If you leave blood even on the ground for like 10 for like some, that's why when we are giving somebody blood, you say let the blood not stay more than this so hours, because if it stays like that, it gets dark, especially in between your legs. So for that, if your menses is smelling, it's not a normal thing.
Yeah, the repeater is asking if your menstruation is 1 day and a half, what should I do?
Visit the doctor. Visit the doctor so that he will ask you questions. He would check you and know what exactly the problem is. Just visit the doctor. Actually, if this physiology thing that we're talking about, like stress, excessive exercise, you are not doing all those, I want to lose weight thing and all that, if it's not there, just visit the doctor. It would give you idea of what to do.
Okay. What is the cause of serious heavy flow?
Okay, maybe this person is also joining. We talk about serious heavy flow is menorrhagia, and we said that a majority of them is because of uh, that fibroid can make you have can bleed, make you bleed like that. Sometimes you can actually be bleeding and there is really no reason. But first, we have to check for us to say there is no reason. Another thing we talk about growth inside the womb that can make somebody grow, can make somebody bleed. We talk about cancers. Cancers can make people also bleed very much. So we talk about drugs. So we talk about it. Maybe I know that when you play it back, you will hear a lot of what we've talked about. But that's why people have serious menstrual flow.
Edith is asking, is it normal for periods to become light after weaning a baby?
Yes, yes. Your period can become lighter because we talk about how weaning a baby can make your hormone change because the hormone wants to help you not to get pregnant. So by the time it's coming back, it won't just come back like as it was before. It will take time as uh, the hormones in your body, the brain, as they are interacting together as they always used to be. They have to do it in time. So it's not abnormal.
Faith is asking, what about menstruation? Stops after 3 days and later comes out the fifth day.
That one, uh, that one is a problem. Why um, I'm a bit like, what should I say? If it comes out on the fifth day, is it continuing? I would have loved this person to add more. Like you had it for 3 days, it stops. It came out on the fifth day. How long did it stay? Because if your menses breaks like that, like breaks, there is small issue. There not like small issue. There is an issue, to be frank. And some of these issues, two issues that are classical like that, is that I talk about that form of, we call it hyperplasia, that are not yet turned to cancer, but in future has the chance to be so. And then the polyp, that the small growths inside the womb. Then the third thing is that if the person is on drugs, some hormone drugs, that's so I would have loved the person to add to
This, yes. Okay, we're almost out of time. We're taking questions relating to the topic. Any other question that is outside this topic, we are not going to take them. I'm sorry. Let's see. Okay, we have one here. Can a 45 years old woman that is still menstruating give birth?
Yes. When you are menstruating, you can give birth. Even a 51-year-old woman that is menstruating can give birth. When we started, we said menstruation tells you that you have the chance of achieving pregnancy. So a woman of that can give birth, can get pregnant and give birth.
Okay. I think we're taking almost the last question on this topic, but this takes us a little bit away from the topic a little bit. It says, I'm on IUCD and my period is heavy. After some months, it becomes normal. Please, what's the advantage of IUCD? Hope it will not affect my uterus.
Okay, there are IUCD, there are different types. So I do hope that you know the type that you are on. There's the one that has hormone, there's the one that does not have hormone. The one that has hormone has the chance of making people bleed anyhow. That's why women don't usually like it most times, but it's very effective. But you see, women bleed. Sometimes they don't even know when their menses starts. They are just on the market and it just starts. They start bleeding heavily. So some women don't like it. There's the one that I don't know the one you are on, but there's the one that has hormone. The one that has hormone it's also in the first 6 months you just start bleeding. But before you know, your bleeding just stops, and then sometimes you don't even see your blood anymore. For a year, you will not even be seeing blood at all, not menses at all in a year. So they are both good. They both have their advantages. The disadvantage of that copper one is that you bleed anyhow, but they are very effective. Now, for whether it has chance, why some women prefer the hormone one is that they even prefer that they are not seeing their menses, because when you don't see your menses, you save blood. Because every month a woman loses. That's why when women are menstruating, they don't donate blood that time. So some women are even happy because they save blood. So every month you are losing like 50 mils of blood every month. Now you have the chance of saving blood. That's the advantage of that one. So, and then both of them are very effective. They don't have that effect of when you want to have a pregnancy, you will not be able to have pregnancy. No. When you want to have pregnancy, once they remove it, you achieve your pregnancy. Then effect on the womb. In fact, the one that has hormone even have advantage, because you hear that we have been saying that there's something we call hyperplasia that can make women. That one that has hormone even prevents women from having that kind of condition. So you see that it has some advantage. It doesn't. I don't know much of any disadvantage that it has on the womb. No, but it can make some people gain weight, like that. So apart from all those hormone thing, I don't think that on your womb, whether once it's placed well and appropriately, it doesn't have that much bad thing that you should
Okay.
forget about.
Let's just take two comments and then I think we'll round up. For Sam, please, you have to watch the video again from the beginning. Your question, and I always see my period 2 times a month. We have to watch from the beginning, please. You can watch the video again. And Dr. Ese spoke about it. So the lady who spoke about the period starts on the third day, stops, resumes on the fifth day, she has responded. Says not as much, just a little blood for the fifth day.
Okay, then that is normal. You know that sometimes our blood flow, she now is having, what I see that she's having actually 3 days menstrual cycle. But you know, when you finish menses, you see that you have drop of blood that comes later, like blood that collected that didn't get off, suddenly just shared out. That's what I think that you are having. That's my thought based on what you write, that you just see a little blood on the fifth day. So it's not a big issue. It's like a blood that was supposed to have dropped before, that was still within your cervix, like the neck of your womb, now dropped out on the fifth day. That's the way it looks to me. If it's just a little blood on that fifth day and there is no more throughout that month.
This will be the last question. What is the medical advice for someone who has been seeing her period in a normal way, but suddenly, after being initiated in secret society for almost 8 to 9 months without menstruating, but experienced severe stomach ache every month? She ran few scans and did some tests to find out what could be the problem, but the result shows that everything about her womb was normal. After about 1 year, then the menses started again, but this time in an abnormal way, from 5 days down to 3 days. What will be your advice, Mar? This one is long.
I don't know the type of test that this person might have done, but
Yes.
I think such a person would have had a complete hormone check at that time that he was having this issue. A hormone check. And sometimes you may be basing it on the secret society, but really it might not just be on that secret society. So it might be that, oh, you visited a doctor, that a complete hormone check may give you an idea that this complete is this hormone. Sometimes even in government hospital like my hospital, sometimes we don't have the complete hormone check. We only have those ones that are so direct, especially because of cost. That's why people don't run. Now, if you run that complete hormone check, you may even see that the what called testosterone is very high in the woman. Some androgens are high, so they are suppressing the estrogen, like what would have made you menstruate. The progesterone, this, so they are suppressing it, and you might not know. And then by the time that on or your body something maybe by drugs or by what those who cause your menses comes back. Sometimes when the menses comes back, especially for that are aging, as you are approaching menopause, as you are growing, your menses will be affected. A woman now that goes getting menopause, by the time she's 50, 45, 50, the menses will be getting ready to stop. So it's like when you are driving the car, you are getting ready to your destination, you also slow down the car. So that's how the menses also slows down until it finally stops. So you may not have 5 days can to 3 days because it is changing, and then before you know it finally stops. But base it on that secret court thing and all that. I'm not saying it's not real, though. I'm just saying that they should also check the complete hormone. Now that the menses is back, it's 3 days. Watch it whether is it regular that 3 days basis. Every month, you eat every 3 days. Watch it. If it's every 3 days, you don't have a problem. But if you notice that it's fluctuating, do visit a doctor, a medical person. Let him do complete hormone check for you.
Thank you, Ma. If I may add to what you said, Ma, as an advice too, is please, if you didn't see a doctor, we would not encourage you to go to the lab and just carry out a scan, because sometimes people just wake up, they go to the lab and carry out the scan. So
Sure.
please don't go to do the scan again. It's important you go see a doctor first, and then before you go carry out any test when necessary. We are out of time. Ma, do you have any final words? For those who are just joining us, please, you can watch the video all over again. Some of your questions have been answered. That is why I didn't take them. Apologies. Ma, any final words?
So final words is menstrual hygiene, because the menstruation means that you are bringing out blood every month, and blood is a good culture medium for infection. Is one of the best culture medium for infection. That means that you can get infected easily during your menstrual period. So menstrual hygiene is key. You need to change your pad 6 to 8 hours, every 6 to 8 hours. If you are the one that has regular bleeding, if you are the one that has bleeding excessively, 4 hours, or when your pad seems seemingly soaked, for those that have it heavy. But if you don't have it heavy and your pad is not seemingly soaked, every 6 to 8 hours, try and change your pads and make sure you discard them appropriately. Then that's a good time for you to have a morning and evening bath. It's not a good time to just do morning bath and sleep. Remember that the blood is a good culture medium for infection. Then people also have this aversion, like some people tend to want to have sex. I'm not the propagator that you should have sex at that period, and if you have to, you must do protection because of that same thing, that the blood is a good culture medium for infection, and you should try as much as possible to help yourself. Thank you.
Thank you. Thank you very much, man. Dr. Israel, can you hear me? Oh, I
Yeah,
think
I
your
can
call
hear
is
you.
okay. Okay. I
I can hear you
yes.
now. I want to say thank you very much, Dr.
Same.
Ekuaze. You've been a very wonderful person anytime we call you to join us. Thank you so much. And for our
Thank
listeners, I think she has said a lot. Please, I still like, I will always say this. Um, we try to tell you the right persons to see at every given time. You remember anytime you say anytime a question come in, Dr. Fred, you know that I will always want to tell the people who to see. So you not just go and meet anybody because he's bearing the word doctor. Because there are so many people that are not really doctors, but they are bearing that name doctors. So when you have any issue concerning your menstrual situation, please try and see a gynecologist. That is, doctors that are specialized in women. Just ask, is this doctor special? If you don't know how to pronounce the gynecologist, now woman, this doctor they treat. If it's not, please now and find a doctor that treats just women. And so it will give you the best. Mostly for that lady that have that full story, it will give you the best. Please. Um, Thank you so much.
Thank you. It was a privilege and honor to be with Ask the Doctors.
Thank you so much, Ma, for your time on this program. I think this is like the third or the fourth time because you spoke about fibroid. I think you spoke about infertility. Somebody was
Yes.
asking us to talk about fibroid. We have spoken about fibroid. I think we have a video on that on YouTube.
Yeah.
We are grateful.
Thank
Thank you for pulling you out this evening. We say a very big thank you. And then
thank
to all the viewers here, please, in case you joined us after we have started, you can go back and watch the video from the very beginning. Help us share these videos to your friends, other ladies that would benefit from this knowledge. Please help us share the video. We want to say a very big thank you once again. And we hope
thank
to see you guys next time, this same place every Sunday by 8 p.m. Thank you so much and have a great night. Bye bye.
Bye.
Bye bye. Bye bye. Yes. Bye bye, everybody. Bye bye. Thank you. Thank you. Thank you. Thank you. We'll see you all next week, Sunday. Take care and good night.